Hey everybody, Dr. Small here, board certified internist. Have you ever Googled your diagnosis, Googled your symptoms, gone down the WebMD rabbit hole, or even used AI? Yes, we all have. And sometimes that insight can be extremely calming, especially when at a click of the button, you can get all the answers you want. All good, right? Until you get some crazy diagnosis like possessed ghost throat, esophageal ectoplasm, and laryngeal gremlins. And your doctor just looks at you and says, you have acid reflux. So what's up with that? Why do we get strange answers sometimes? That's what today's topic is about. Why do we get hallucinations? What did I say? Hallucinations? Yeah, AI hallucinations. So in this video, we'll discuss AI hallucinations, the dangers behind those hallucinations, and discuss why sometimes AI goes wrong. So what exactly is an AI hallucination? I know it sounds like I'm giving a diagnosis, and I'm maybe saying that AI has delirium or psychosis, but the phenomenon I'm discussing is when AI, or your computer, generates an answer that is partially or completely full of nonsense. Essentially, you're getting ungrounded, fabricated data that makes no sense in reality. And what's even more troubling with these hallucinations, they can sound extremely factual and completely logical. So let me give you an analogy. You have a chef who's collected every single cookbook known to man. However, he or she has never tasted anything. He has the knowledge of millions of recipes. He's memorized ingredients and knows different preparation methods. More impressively, he can make a recipe from scratch that looks perfect. The catch is, the recipes are based off of pattern recognition. He knows that flour sometimes goes with sugar and then sugar goes with baking soda, but he's not pulling from experience. So now take our imaginary chef and ask him to make a dessert. He prints off a recipe and all of a sudden you see add 3 cups of motor oil. Why? Because motor oil might be the same thing as 3 tablespoons of lard. And this explains what hallucination is. You have all these things that seem to make sense, or at least seems to make sense to an AI model, and it pushes that data out to you. So why does this happen? Well, it happens for several reasons. AI models are based off of large amounts of data that they pull from the internet. And we still know that the internet is the wild, wild west. It isn't necessarily pulling data from a medical textbook or some curated source. It's not necessarily pulling unbiased data. It can be pulling incomplete data, or it could just be making up answers from random data that it gets that has completely no base in reality. The second problem with AI is it's based off of predictions. It's trying to predict the next sequence that comes when you're asking it a question. So to ask it a series of questions and it tries to predict what the next answer should be. So let me give you an example. I had a patient who came in and he showed me an x-ray of his shoulder and said, "What do you see?" And I said, "That looks like osteoarthritis of the shoulder." And he said, "Well, you didn't see the shoulder impingement?" And I'm like, "You see shoulder impingement?" He's like, "No, I used AI and I put the image through there and it says I have a shoulder impingement." Now, this sounds extremely logical. The problem is x-rays can't show nerves. You need an MRI for that. Essentially, he went on to say that the AI said, well, because there's a space in there and maybe a nerve could fit in there, therefore that's impingement. And though this could be true, but no radiologist ever, take the most expert radiologist you could find, is ever going to say that you can diagnose impingement from an x-ray. So this is something where AI is predicting an answer and giving him an answer, and that's probably based off of what he inputted into the computer. Because again, you definitely need an MRI to diagnose an impingement of a nerve. The third reason why AI could be generating a wrong answer is because it's not based in reality. It's not pulling data, or at least it's not giving you answers based off of its own reality. So again, it doesn't have a human experience. And back to the shoulder impingement example I gave, it would need a professional, a radiologist, to know that this can't be diagnosed by this modality, right? MRIs are for soft tissues, x-rays are for bones, that kind of thing. So again, AI lacks a realistic, real world basis to pull data or to present data. The fourth and final thing is, I would say that AI is only as good as the inputs you put into the computer. What do I mean by that? So for example, if you start Googling or asking questions about chest pain, you talk about the chest pain you have, why would I come up with a different answer than a patient? Well, here's the facts. Let's say you come in, you have chest pain. I don't know what you're talking about. I have no idea. So I start putting it into an AI model and you start using the same thing. I am twice as likely, 80% likely to get the right answer when you're about 50, 40%. The reason is because I have different definitions of chest pain. For example, I'll know that you could have pleuritic chest pain, which is chest pain that gets worse with when you're breathing. I know that there's chest pain that's stabbing, chest pain that's crushing, chest pain that radiates somewhere, and these give different diagnoses. So I'm going to start asking a whole bunch of questions to lead me down a certain pathway. So this is why you can get strange diagnoses, rare diagnoses, or things that don't make sense. I'm pulling from experience where somebody is just using an AI model and not describing things right. So these are 4 reasons why AI can just give you a wrong answer. So next, I have to talk about the dangers of this. If you're looking for the best flavor of ice cream and AI gives you a wrong answer, no harm, no foul. But when you're dealing with your own medical issues, yes, the wrong answer can actually be scary. But let's explore why. If you get misinformation or misdiagnosis, one of the main things is you can delay treatment. So if you had something super serious and you let it fester, you can just cause further pathology. Things can get worse. Let's say it's not even that. Let's say it's not the worst case scenario. You put something into AI, you get the wrong information, but you just worry, and that causes stress. So that's not good for anybody. Another reason that it can be dangerous is if the information is being pulled from the wrong source. So let me give you 2 examples. One thing is that when you pull from data and it is medical, for example, you want that data to be peer reviewed. You want it to be a standard of care. For example, if you come in, you have a general issue, general pathology, you want the doctor to pull and treat you with what everyone's getting treated with. Sometimes what's wrong is that AI will give you data that might be the newest, latest thing, but the newest, latest treatment could be experimental. It is not something that every doctor knows, and it's not commonly used. And although those things are good, you want to go with the standard treatment before you go on to something experimental. I'll give you another example. I had a patient come in, she had rheumatoid arthritis. She asked me to give her methadone. Well, methadone is not a common treatment in anything for rheumatoid arthritis. And she was arguing with me and said, well, you're just not up to date with things. So I looked it up and I couldn't find any data in the normal databases that an internal medicine doctor would use. I did find some articles online that some rheumatologists across the country were starting to use this. Now, me not being a rheumatologist, it's not something I normally treat. I do have a special interest in rheumatology, so I'm willing to treat people further than an average internal medicine doctor would, but I wasn't comfortable giving methadone. And again, it's not quite yet the standard of care. So that's another issue with AI models, is you don't know what resources it's pulling the data from. Last thing I would say in this section is that medicine is still an art. Sometimes it can't all be factual. I'll give you an example. So I had a program director and she was very factual, and everything you did had to be science-based. It had to be proven in a paper, and it had to be like a standard of care. And I remember once she's presenting a patient and she said, you know, I did this, and we asked her why. She's, again, very factual, and she said, I don't know. But in the end, she was right. And that is the art of medicine. Sometimes you just get an inkling because you've seen things so many times. Nurses might approach you and say, watch room 6 tonight. And if you look at the chart, everything's brought to the patient's ready to be discharged, but in the middle of the night, that patient crashes. No rhyme or reason, but again, there is an art of medicine, and that only comes with, again, the human experience. So in conclusion, what is the takeaway from this? Well, AI is a great tool, but we have to remember it's a tool. Yes, it's great for getting information, drafting emails, or it can be an aid to a doctor and helping him hone his thoughts. Again, you would not want to go to a physician with your AI and tell him this is the right treatment. And you wouldn't want your doctor relying just on that. Everything has to be based in a clinical setting and clinical reasoning, and based in reality from a doctor's experience. So again, use AI as a tool, use it to help guide things, but it's not the savior of medicine. You need to compile all the information you have going forth. Anyways, stay safe and until next time.